Hello and welcome to this month's A&D Medical's live Q&A. My name is Abraham. I'm an advanced medical practitioner and pharmacist, and I am the host and lead of the YouTube channel at A&D Medical, where we create content all about cardiovascular health and well-being. Just a bit of housekeeping to begin with. Every first Thursday of the month, 8 AM PST, or if you're watching in the UK, that's 4 PM. GMT, we do our live Q&A on the A&D Medical channel where we answer your questions, all related to cardiovascular health. So we respond to comments that you put on the channel, and we respond to the comments that you put on the live show as well. I try my best to respond to all of them, but please remember, we usually do the live for about 15-20 minutes, so time is a little limited as well, but I will do my best to answer every single question, and if I can't answer them, I'll definitely answer them in next month's episode. So I just want to firstly start with saying a massive big thank you to all of our subscribers. We started the channel about 2 months ago, and we're getting thousands and thousands of views per day, which is awesome. But best of all, we have hit 97 or 98 subscribers now. So we've nearly hit 100. So if you're watching our live today and you haven't subscribed yet, what are you waiting for? Just click that subscribe button. Join us and learn everything to do with cardiovascular health, whether it's blood pressure monitors, whether it's our body composition weighing scale, whether it's how to lower your blood pressure, looking at myths and doing experiments and everything. We have a really, really fun channel. So definitely subscribe to us and join us on our journey as well. All right. So without further ado, let's begin our live Q&A. It's Thursday, 5th of June. So let's go. We got a comment about a week ago or 2 weeks ago from I'm Janet 90, and it was a really good comment actually. The question was, does the 30-minute rule apply to snus as well? I'm not sure if I'm pronouncing that product right, but they've also wrote in brackets tobacco pouches under your lip. I've seen these tobacco pouches more and more actually. I'm seeing it on social media. I think a lot more people are using them. So it's basically a pouch and it's got tobacco or nicotine in it, and I think you place it underneath the gun. So that's for anyone who doesn't know, similar to myself. Now, I think that's a great question. Short answer is yes, it definitely applies, and I'm going to explain why. So this is from the video on how to take your blood pressure, basically, when you're using your blood pressure monitor. And we always say the 30-minute rule. So no caffeine, no exercise, stuff like that, 30 minutes before taking your blood pressure, and no smoking. All right. So when we say no smoking, you know, it's all about nicotine really. So whether you're smoking it and it's inhaling, taking in nicotine, whether you're chewing it, you know, whether you're using the tobacco pouch products, it's all going to absorb the nicotine. And nicotine basically causes what we call vasoconstriction. So that means that it causes your blood vessels to narrow. Okay, so I don't really have a pipe, but imagine this is your blood vessel. And imagine there was nothing on the end of this. If there's water just, you know, flowing through this, just imagine it's a hose pipe, and I put my finger at the end of it, the pressure is going to increase, right? It's going to go further. It's going to be more velocity on the water. And that's essentially what's happening, but the entire blood vessel is constricting, all right? So that's basically causing our blood pressure to go up. And it's simple as that. But here's why it gets interesting when I was thinking about it, because these tobacco pouches, right? We have medication that we basically absorb through our mouth, all right? We call it, for example, sublingual medication. I'm just going to put my phone on Do Not Disturb because it's going to start popping out. Yeah, we have medication which we call sublingual medication, and it absorbs really rapidly. For example, there's something called a glycerol trinitrate spray. It's called a GTN spray, and we use it for patients who have angina, who get chest pain, basically. And this GTN, you spray it underneath your tongue, and it basically dilates the blood vessels, so you get more blood to your heart. The reason we love this medication is because sublingual preparation medication, so that kind of formulation, it absorbs rapidly, like really fast. So essentially, by using a tobacco pouch, you will also get very rapid absorption as well, because you have a really high blood supply to the mouth, basically. So it's really important you're not using it, you know, and it's going to elevate your blood pressure. It's going to give us a false reading. So like we say, 30 minutes, no smoking, no eating, stuff like that. This applies to the tobacco pouches, snus, whatever brand you're using as well. And that's why we always tell patients to, sit calmly for 5 minutes, keep your feet flat on the floor, keep your back supported when you're taking blood pressure, no recent caffeine, exercise, nicotine, because we want to get readings that actually reflect your blood pressure, not ones that are affected by a stimulant, basically. And to give you an idea of how much nicotine actually can spike your blood pressure by, it can spike it by about 5 to 15 millimeters of mercury. So 5 to 15, 1-5, all right? And sometimes more. So, imagine if your blood pressure is around, 125 over 79, for example, and you're not, taking precaution about this, and you're using, nicotine-containing products, and you're smoking or using the pouch before taking your blood pressure, and it increases your blood pressure to 140, all right, over 85, because it's going to increase your blood pressure, like we said. That way, your medical provider might actually assume that you have high blood pressure and might actually then start you on medication, because they're thinking, well, your blood pressure is raised, so we need to do something about it, because as everyone knows on this channel, blood pressure is a silent killer, and we want to lower it to reduce your overall risk. So really think about it. So the 30-minute rule definitely applies to snus. It definitely applies to nicotine pouches, chewing tobacco, even nicotine gum and lozenges to some extent as well. So that's a good one to think about. Basically, if it has nicotine, it can really mess up your readings. So I hope that was helpful. Thank you for your comment, and I hope that was helpful. Okay, so I'm just going to quickly check the comments. Okay, we've got a comment actually. So thank you for your comment. We've got a message from Hadia Husseini. My doctor wants to start me on 2 blood pressure medications. Isn't that too many to start on? That's the story of my life, that actually, because I start a lot of patients on blood pressure medication, and quite often a lot of patients are reluctant sometimes to start medication because they want to do lifestyle changes or whatever. And especially if you want to start them on dual antihypertensive, so dual blood pressure medication, they can be even more reluctant. Now, this isn't medical advice at all. This is just information about how blood pressure treatment works. But the way that I always like to explain it to patients is blood pressure treatment isn't like a painkiller, for example, okay, or something to reduce your pain. Generally speaking, if you are prescribed, let's say, morphine for pain, okay, the higher the dose of the morphine, if they increase the dose slowly and gradually, the more pain relief you should get. Okay, so that's the concept. So a higher dose equals more pain relief. Blood pressure medication is quite different, actually. If you start a medication, let's say any blood pressure medication, let's say it starts on 5 milligrams, and it can go all the way up to 40 milligrams, let's say, for example. The difference between the 5 milligram dose and the 40 milligram dose of that blood pressure medication in terms of blood pressure reduction is very minimal, usually, maybe by about 5 millimeters of mercury difference. All right. So that's the bit where a lot of patients, even some medical providers, get wrong. So it's not about starting you on one medication for blood pressure and then just saying, okay, we're going to increase the dose to 10 milligrams now. We're going to increase it to 20 milligrams now because the blood pressure is not coming down. Because increasing the dose really isn't going to bring down your blood pressure further from the starting dose, usually in most cases, by the way. And all it's going to do really is probably just increase your risk of side effects. So a newer strategy with the latest guidance really now that most medical providers are doing is when you have high blood pressure, they'll start you on 2 blood pressure medication, usually, generally speaking. And they'll usually start you at a low dose on the 2 tablets because they work really well together, these 2 medications, to bring down your blood pressure much more than one tablet will do at a higher dose, and with less side effect risk as well. So it's quite fascinating how it all works, but generally speaking, from the sounds of it, your doctor is doing the right thing. But again, this isn't medical advice. If you are worried about it, please do speak to them and let them know how you're feeling about it. But that is generally how blood pressure medication works. So I hope that was helpful. Now, I want to move on to the next question that we've got. And it was a great question. It was all about how do blood pressure monitors actually work and why does cuff size matter? We go through this quite a lot on the channel, but last week I had the pleasure of speaking to our engineers at A&D Medical, both Jerry and Adam, who are really awesome engineers at A&D Medical. By the way, we have many engineers at A&D Medical, but I got the pleasure of speaking with Jerry and Adam, who are fantastic. And they really answered my questions with an engineering perspective on how things work. So one of my questions was actually going into a lot of detail about how our blood pressure monitors work, how our cuff works, how the cuff size matters. Why does it matter? And this comment on how the blood pressure monitors actually work and why the cuff size matters is perfect, because I'm going to really give you some explanations now, which I thought was pretty amazing. And I'm sure a lot of you watching are interested in blood pressure and cardiovascular health. So I think you guys will find it interesting too. So you've probably seen the standard way of measuring your blood pressure. So we call this oscillatory method, and it's usually a SVIG, basically a manual one that they pump at your medical provider's office. They put it on your arm, and then they use a stethoscope, and they basically then are listening for sounds. Okay, so this method is listening for sounds. So they're using a manual cuff. They inflate it until the blood flow stops through your arteries, and then as they deflate it, whilst they're listening with their stethoscope, they are listening for what we call Korotkoff sounds, all right? And the first sound that you hear, it's like a lub-dub, lub-dub, lub-dub. You hear that? That is basically your systolic blood pressure. So they'll have a gauge on the SVIG, and the first sound you hear, that is your systolic blood pressure. So that's when your heart is actively pumping, so it's a higher reading. And as they continue to deflate, they're still listening, the provider's listening, and they'll hear the lub-dub, lub-dub, lub-dub. And once it gets to your diastolic blood pressure, the sound will stop. Okay, and that is your diastolic blood pressure, so it's the lower sound. So it's all based on how the blood flow sound changes as the pressure releases. So that's our, if you want to call it, the old school way of taking your blood pressure, which is very, very accurate, that we all know. Now, when it comes to digital home blood pressure monitors like our A&D Medical blood pressure monitors, this is the Precision Check Pro monitor in my hand, they don't listen to sounds, all right? They are actually listening for, well, not listening, but detecting tiny vibrations. So it's called the oscillometric method. It's a big word, but what it means is just it detects vibrations in the artery wall as the cuff deflates. So that's why blood pressure monitors generally take about 30 seconds to give you a reading. So it inflates, then it deflates, and it's then sensing every pulse wave. And the process is basically doing calculations to basically then calculate your blood pressure from. So that slow, steady deflation is essential because it helps the monitor pinpoint exact amount for your systolic and your diastolic pressure changes. So that's pretty cool in terms of how it works. But the bit that really blew my mind really was when I was speaking to Jerry and Adam, and they explained to me how the cuff size matters. So I talk about it in our videos quite a lot, how a large cuff can give you incorrect readings, and how a cuff that's too small for you as well can give you incorrect readings as well. But why is that, all right? So Jerry mentioned a really cool thing. So he told me that basically, imagine trying to take your blood pressure with a tourniquet, okay, or like a rubber band, like really small, okay? You can tighten this to stop your blood flow, all right? But you'd barely be able to detect a gap between when your blood starts flowing and stops flowing because it's so thin, all right? Now, so you basically, as a result of that, if you're using a tourniquet or a rubber band, your systolic and diastolic numbers would be squashed together, so they'd be inaccurate. So the same thing I want you to think about happens when you use the wrong cuff size, okay? If the cuff is too wide, so if this cuff is too big for me, it applies pressure over a larger area. So it might show a lower blood pressure than you actually have. And the same principle applies if it's too small. So if this blood pressure cuff is too small for me, this is our A&D Medical wide range cuff that just comes with our devices. But if it's too small for me, it's going to over compress the artery, giving falsely high readings. So the bottom line is the correct cuff size makes all the difference in getting accurate readings. And it basically allows the monitor to detect your true systolic and diastolic values. So that's pretty impressive. But one other thing that's super impressive is what makes A&D Medical special. Jerry and Adam explained to me basically that A&D Medical, we use the oscillometric method. And what sets us apart is how well, basically, it's being clinically calibrated. So in case anyone is new to the channel, I always talk about this. Here at A&D Medical, we invented the digital home blood pressure monitor in 1977, all right? So Our engineers have spent years in comparing their digital readings to the gold standard manual method that we spoke about. So that side-by-side testing is what allows A&D monitors to stay accurate, all right? They don't just say this is accurate. We've proven how accurate A&D medical blood pressure monitors are, and it's been proven in study after study after study. And believe me, A&D Medical runs clinical studies all around the world. We're talking Italy, we're talking Germany, we're talking the US, Russia, China, UK, Taiwan, so South Africa, all over. It's global, and because testing across different populations helps ensure accuracy for all users, different ages, health conditions, body types, you name it. All right, so we've done hundreds, more than that, studies basically showing how accurate A&D medical blood pressure monitors are. And I've spoken about it before, making sure that your blood pressure monitor is on the validated device list. This is critical because so many blood pressure monitors that you can buy online, they're not on the validated device list, and basically means that they are not accurate. They haven't been clinically tested to show accuracy at taking blood pressure. And the last thing you want is to be using a blood pressure monitor at home and it's giving falsely raised blood pressure, for example, and give you a false high blood pressure diagnosis, or falsely low blood pressure, which is even more dangerous because then it's not showing that you have high blood pressure. All of a sudden, you're at a much higher risk of heart attacks, strokes, kidney damage, all those problems that are associated with high blood pressure. So it's really important you have a device that you can trust and it's on the validated device list. So it's really cool what I went through with Jerry and Adam. So I just thought I'd share that with you. So just to recap, digital blood pressure monitors use vibrations, not sounds, to detect your blood pressure. Cuff size absolutely matters. Wrong cuff size equals wrong readings. And A&D medical blood pressure monitors are trusted, and we have calibrated them against the gold standard and are tested across the world via many, many studies. And big thanks to Jerry and Adam, our engineers at A&D Medical, for sharing all of this. I learned so, so much. Okay, so it looks like we have come to the end of our live. I can't see any other comments at the moment, but I really hope that was helpful. What we'll continue doing is we will continue looking at your comments that you leave on videos, and we'll get back to you on our live. Do come in and join us on our live shows as well and give us a comment. We'll get back to you straight away. But I've really loved doing this, and it's been really fantastic watching the channel grow as we put in more and more content all about cardiovascular stuff, from your blood pressure to doing experiments. It's been really, really fun so far. So definitely, if you haven't subscribed to us, please do join us. And as we always say at the end of every A&D Medical video, A&D Medical, discover precision.